Good. Close this door. So it's just after 7. We want to welcome everybody to the classes. We'll probably have a few more people log on, but it looks like there's a couple new people this time. And if you haven't been here before, if you would care to just unmute for a moment and just say hello, let us know how you found out about the classes. We're just kind of curious. You don't have to, but we always like to hear how you got referred to these classes and maybe what your expectations are, what you'd like to gain from them, and we'll try to accommodate. So anybody want to share how you found out about the classes if you're kind of new? Yeah, Jennifer.
I'm not really new, but I've been haven't been to too many classes recently. I've been doing the lifestyle and nutrition class that they're offering down in Roseburg. So I kind of like have to juggle my time, but this topic's interesting because I want to obviously prevent stroke and heart disease, and it's pretty prevalent. And I've worked in a stroke unit as a nurse, and I've seen younger and younger people succumb to a stroke, and it's sad. And people that are my age, like early 50s, and it just seems like that is way too young to have that kind of a problem. So again, I'm not new, but I haven't been here in a while. So hi again.
Well, welcome again, and really happy to hear you're doing the courses down in Roseburg, and yeah, we'll be kind of discussing heart disease and stroke. The risk factors are pretty similar, and so that's why they go together so well. Okay, anybody else care to chime in, whether you're new, how you found out about the classes, and if you're not new, maybe you have just something you want to say about how you're doing, whether you're doing well or having problems. Now's a good time to chime in, or maybe a little later if you need to get more comfortable. You don't have to turn your camera on. You could just unmute yourself and we can see that you've unmuted. And don't really see anybody else. Okay. Well, we have what we might call a quorum of 20. And we'll see how that progresses as the night goes by. Anyway, we're going to go ahead and start this segment. And again, if you have questions, feel free to chime in anytime. We probably should have plenty of time to have further discussion and chat about it. So tonight we're talking about heart attack and stroke and the underlying etiology of both of those. But we used to think it was our genes, which predispose us to having one condition or another. And we've since learned over time that genes account for probably 20% plus or minus a bit of whether we develop heart attack or strokes. And that about 80% of whether we develop those conditions is related to our lifestyle choices. So the lifestyle choices, remember, are the 6 pillars of lifestyle medicine. What we eat, how we move, the chemicals we choose, how we deal with stress, our sleep pattern, and our social contacts, social connection. And so if we maximize those, it will give us the best chance of preventing heart attacks and strokes. Remember, in our country, by age 10, most every child autopsy at that age like if a child's been in an accident and got killed and an autopsy is performed, they show the early stages of atherosclerotic change. So heart disease actually starts in childhood in our country, and our country's lifestyle is kind of trying to spread around the world a bit. So whatever is true in our country is probably true throughout the world, except maybe the blue zone areas where they're the longest lived, healthiest people in the world. But even those blue zones are kind of trending toward the modern way of eating and the modern way of moving. And so not the healthiest choices. With that said, I want to go ahead and play a video, which most of you who have been to these classes have seen before. Why am I playing it again? Well, there are just some videos that are worth seeing more than one time because the information is just so important and so valuable. And this comes from Dr. Greger. It's a video which you have probably all seen, but for those of you who haven't, it's definitely worth seeing. And for those of you who've seen it, we're going to go to it right now. After this, we're going to have Scott chime in. And we'll see if you guys have.
We can't hear you, Charlie, if you might be muted, Charlie.
I did. I got muted.
Yeah.
Thank you, Scott. And so we're going to go back to the share and, you know, the wonders of technology. Okay. And then we're going to go on to our first video, and it's how not to die from heart disease. Now, why are we starting with heart disease and not stroke? Well, the cause or etiology of both of the conditions is generally related to atherosclerosis. They have similar causes. So let's see what we can do to prevent and reverse heart disease. And we can follow the same guidelines for stroke. Okay, here we go.
The most likely reason most of our loved ones will die is heart disease. It's still up to each of us to make our own decisions as to what to eat and how to live, but we should make these choices consciously, educating ourselves about the predictable consequences of our actions. Atherosclerosis, hardening of the arteries, begins in childhood. By age 10, the arteries of nearly all kids raised on the standard American diet already have fatty streaks, the first stage of the disease. Then, the plaques start forming in our 20s, get worse in our 30s, and then can start killing us off. In our heart, it's called a heart attack. In our brain, it can manifest as a stroke. So if there's anyone watching this older than age 10, then the choice isn't whether or not to eat healthy to prevent heart disease, it's whether or not you want to reverse the heart disease you likely already have. Is that even possible? When researchers took people with heart disease and put them on the kind of plant-based diet followed by populations that did not get epidemic heart disease, their hope was that it might slow the disease process down, maybe even stop it. But instead, something miraculous happened. The disease started to reverse, to get better. As soon as patients stopped eating artery-clogging diets, their bodies were able to start dissolving some of the plaque away, opening up arteries without drugs, without surgery, suggesting their bodies wanted to heal all along, but were just never given the chance. That improvement in blood flow to the heart muscle itself on the left was after just 3 weeks eating healthy. Let me share with you what's been called the best-kept secret in medicine. The best-kept secret in medicine is that sometimes, given the right conditions, the body can heal itself. You know, if you whack your shin really hard on a coffee table. You can get all red, hot, painful, swollen, inflamed, but will heal naturally if you just stand back and let your body work its magic. But what if you kept whacking your shin in the same place day after day? In fact, 3 times a day, breakfast, lunch, and dinner. It'd never heal. You'd go to your doctor and be like, oh, my shin hurts. The doctor would be like, no problem. Whip out their pad, write your prescription for painkillers. You're still whacking your shin 3 times a day. Oh, it still really hurts like heck, but oh, it feels so much better with those pain pills on board. Thank heavens for modern medicine. It's like when people take nitroglycerin for crushing chest pain. Tremendous relief, but you're not doing anything to treat the underlying cause. Our body wants to come back to health if we let it, but if we keep re-damaging ourselves 3 times a day, we may never heal. One of the most amazing things I learned in all my medical training was that within about 15 years of stopping smoking, your lung cancer risk approaches that of a lifelong non-smoker. Isn't that amazing? Like your lungs can clear out all that tar, and eventually it's almost as if you never started smoking at all. And every morning of our smoking life, that healing process started until wham, our first cigarette of the day, re-injuring our lungs with every puff, just like we can re-injure our arteries with every bite, when all we had to do all along, the miracle cure, is just stand back, get out of the way, stop re-damaging ourselves, and let our body's natural healing processes bring us back towards health. The human body is a self-healing machine. Sure, you could choose moderation, hit yourself with a smaller hammer, but why beat yourself up at all? I don't tell my smoking patients to cut down to half pack a day. I tell them to quit. Sure, half pack is better than 2 packs a day, but we should try to only put healthy things in our mouths. We've known about this for decades. American Heart Journal, 1977, cases like Mr. F.W. here, heart disease so bad couldn't even make it to the mailbox, but started eating healthier, and a few months later he was climbing mountains, no pain. Now, there are these fancy new anti-angina, anti-chest pain drugs out now that cost thousands of dollars a year, but at the highest dose may be able to prolong exercise duration as long as 33.5 seconds. It does not look like those choosing the drug route will be climbing mountains anytime soon. Right? See, plant-based diets aren't just safer and cheaper, they can work better because you're treating the actual cause of the disease.
So that's one of my kind of favorite all-time videos when it comes to trying to encourage someone to transition their dietary choices. A little bit going just an ounce further. What convinces me to continue doing this is there are 2 studies in the world literature which actually demonstrate unclogging of the coronary arteries. That means you have to have an angiogram done on a patient. You squirt dye into their arteries, heart arteries, and it shows narrowing. And then you put them on a whole food plant-based diet like Dr. Ornish did or Dr. Esselstyn. And then you repeat the angiogram in 1 to 3 years. And you can see visible opening up in about 6% of the people in Ornish's program, where you did diet, exercise, yoga, group therapy to love more and hate less, and meditation. You take over a patient's life, really change their lifestyle dramatically. They get the biggest buck for the bang. Or you can do the Esselstyn route, which I chose to do, and that is from How to Prevent Reverse Heart Disease by Esselstyn. And he had about 35%, I believe it was, somewhere in that range, of reversal. 34, 35% of the people showed unclogging of their coronary arteries with just their food choice change. So you can choose what you want to do. You can just do food and you'll get dramatic benefit, likely. You could do food with more movement, less stress, avoiding the chemicals, making sure your sleep is maximized, and that you're loving more and hating less, and you would get even more benefit. So this will be your choice. So with that said, I'm done, and I'm going to turn it over to Scott to share with you one of our mentors who we stand on the shoulders of, Esselstyn, and maybe he has some other things to add, or maybe there will be a question from you before he shows the video, whatever works. Carry on.
Yeah, does anyone have questions about that? About what Charlie said about the studies and that's reversal by angiogram, but angiographic evidence, but also the patients in Esselstyn's study, none of them had further heart attacks going forward. And he had patients that were end stage heart disease patients. A lot of them were expected to live out the year. And so they were basically, their cardiologist had said, hey, there's nothing more we can offer you. We've already used up all your, you can't have any more bypasses or stents, and there's nothing more we can do for you. Go see Dr. Esselstyn. And so that was, what he had. But after many, many years, they were all still alive and didn't have any further heart attacks. So that was definitely important to add that. But any questions before I move into Esselstyn lecture? And I want to show you his book on the website as well. But any questions so far?
Don't be shy. Leslie.
Hi, yeah. I started this in mid-February. I'm doing really well. I got my cholesterol rechecked a couple of weeks ago and it's down quite a bit. I'm really pleased about it. I'm curious though, does it keep going down? So like it's gone, like I'm at the top of the healthy range now and I want to keep going, but my understanding is you see progress from dietary change pretty quickly. I'm curious if it keeps progressing, or do I need to, I don't know, is there any, I guess I'm just curious what to expect. If I keep, like, should I expect more progress or?
I'll chime
Yeah,
in first.
Yeah, go ahead.
And then Scott will chime in. For me personally, 1 month of going complete, like we threw out every processed food and went out and bought beans and lentils and fruits and vegetables and whole grains, threw out all the animal products and the processed foods. We went, within a week's time. We transitioned. Within 1 month after doing this, my cholesterol went from 240 to 148.
Wow.
And then several months later, maybe 4 to 6 months, it was down to 135.
Okay.
So hopefully that will encourage you. Now, my wife's went down into the 130 range and she added a bunch of nuts back into her diet because she liked nuts after months. And her cholesterol went back up to 170. So it will fluctuate depending on how much fats you're getting in the diet. And that's been my experience. So Scott, how about you?
Yeah, so it varies between patients. I've had people like Charlie that dropped 100 points in just a few months, and then some people progress much more slowly. And so a lot of it has to do with, there's several factors. So there are genetic factors, and then there's, part of the genetic factors have to do with having enzymes in your liver that break down cholesterol. Some people have more of it, some people have less of it. And then we also store cholesterol in our liver. So we have no dietary need for cholesterol. So our liver, our bodies are great cholesterol recyclers, because our liver makes all the cholesterol we need, because we need cholesterol because we need it to make cell walls and hormones and things like that. But because of that, because our physiology was laid down millions of years ago to be eating 100 grams of fiber a day and not really eating little, if any, cholesterol, any animal products, because we're predominantly plant eaters, we didn't know how to deal with cholesterol, and so we ended up, it gets deposited in our arteries and things like that. So it depends. So as far as how fast it goes down is depends on some of those things, enzymes, how much you have stored in the liver. And so it can go down quickly or it can go down slowly. And I've had patients that, they were in the 300s when they started a plant-based diet, and now they're in the 200s. So they dropped that 100 points, but they haven't been able to get it down any further. And sometimes that ends up being some of those genetic factors. But one thing, what I always try to tell those patients is what your overall diet is and what your lifestyle is, that has more determination to whether you'll have a heart attack or stroke than what your actual number is. And so if somebody still has, say somebody has a total cholesterol of 225 with an LDL of 150 or something like that, and they're eating a whole food plant-based diet for a year or more, and they have exercising, they don't smoke, they have good sleep, good social support, all those healthy lifestyle factors, their risk of having a heart attack or stroke is extremely low, even though their numbers aren't necessarily ideal. But somebody eating the standard American diet that smokes and isn't exercising and living a stressful lifestyle, they might have the exact same cholesterol numbers as the other person, but their risk of having a heart attack and stroke is really high, because it's not just what your cholesterol numbers are that determine whether or not you have a heart attack or a stroke. It's all of these other factors too: oxidative stress, inflammation, the presence of heme iron, lots of other factors that go into whether or not you'll have that heart attack or stroke. So, and then different types of cholesterol particles, things like some other markers like apolipoprotein B, LP(a). There's a lot of other, your calcium scoring. There's lots of other ways to determine risk besides just what your cholesterol is. So that's a long answer, but I just kind of I try to get people not to focus too much on the cholesterol numbers, just really focus on what you can control, which is your diet and lifestyle. But yeah, it's good to follow the numbers, because it does still provide value, and it's a good motivator because you see those numbers go down, and then your risk is going down with those numbers going down, but there are some limitations to how much information you get from the numbers.
Great. Thank you so much.
You're welcome.
Alice.
Oh, so I find if somebody has had a heart attack or stroke or TIA, which is a mini stroke that reverses, that they're really motivated for about 3 months. And then they start smoking and they go down the slippery slope. And I'm just curious how you guys address that. It's like you have this 3-month grace and they're really, really scared and motivated, but then they just kind of backslide back into old ways. Anyway.
That's why people need to come to classes and have support groups, and then really Dr. Ornish says it himself in his program. It's, you only, just like you said, Alice, you only get maybe a few months, maybe up to 6 months of motivation for change when you have a scare. So whether that's a heart attack, a stroke, even a cardiac arrest, you only get maybe 6 months of motivation for change. So what really does studies show longer term motivation for change for months and years is focusing on pleasure and joy, things that you have that provide value in your life, and not so much just the fear of dying. It's the joy of living and really focusing on those things. And that's Dean Ornish focuses on that in his program, and he has really good 1 and 5 year adherence rates because of that. But so that's what I try to do: give people support, keep giving them motivation as far as things that they get to do and things they get to enjoy by being healthy, rather than just the fear of something bad happening.
The other comment I might make is Dr. Esselstyn, in his study, saw the patients every 2 weeks for 5 years straight, every 2 weeks, to keep them in the study on point. So my suggestion is, and what I encourage everyone I see who's enthusiastic or not enthusiastic about changes, come back in 2 weeks. We're going to discuss this. The people who are successful continue to take a lesson, so to speak, like a tennis lesson or a piano lesson. You got to keep doing it to kind of build up the habit pattern. And then once you're getting the benefits from this and feeling better, you may likely keep it up. But you're absolutely right that if they're not being followed by someone, they're likely easily to fall off the train, so to speak. And that's sad, especially in a culture which doesn't really embrace this. So we need to change our culture. And like Scott said, these classes are one of the attempts, providing a resource where people can come every week if they choose to. Good comment. Doug. Just unmute yourself first. There you go.
I was curious how much nuts your wife was eating. I eat a quarter of a cup of walnut halves and about a tablespoon and a half of 4 different seeds every day. How's that compare to what she was eating?
I think what you're eating is just fine. She was eating closer to, I think, 3/4 of a cup of nuts for the day, maybe up to a cup sometime.
Okay, thank you.
She's since stopped that. Gone back to the quarter. Anybody else? There's a couple comments in the chat room. I think, I don't know if you saw
You
it.
could answer those while I'm playing the video if you want. 'Cause
Okay,
it's
that'll be good.
One's off topic there. All right.
Okay,
Let me share my
good.
screen. So I'm going to be showing you guys, it's on the class website, some of Dr. Esselstyn's lecture. This was actually recorded when he was in Portland, Oregon, actually several years, maybe 8 or 9 years ago now. And I just want to show you where it's at. So this is our website, livelifestylemedicine.com. So hopefully you guys are all familiar with it by now. You go to videos. So if you click on the videos section, I have a whole bunch of different videos here you can check out if you haven't yet. And I'm going to go down to Dr. Esselstyn's lecture here. Let me click on that and expand. And I'm going to start it at minute 7. So just to kind of give you, we're just going to go from 7 until 20. So let me do this. So this is, yeah, from Portland, Oregon. And so he's kind of going to go over some of the physiology of a heart attack, and this would work for a stroke too. Most strokes are clotting strokes, so thrombotic strokes, like 80 to 90%. And so there are bleeding strokes as well, but that's usually from if you have a weak blood vessel somewhere and you have really high blood pressure and you get a little rupture of a blood vessel and it bleeds, and that can cause a stroke too. But most of the strokes that people we know that suffer strokes are these clot strokes, thrombotic strokes, which is the same physiology in the brain arteries as what's going on in the heart arteries. And so Dr. Esselstyn is going to be talking about the heart arteries here, but this is really, really good because he goes through kind of how everything works and kind of gives you a visualization of what we're talking about here and how a heart attack occurs. Wait. Wait. Sorry, guys. A second. Let's see. Here we go. So can you guys hear that okay?
I can't hear it.
No. Oh, I just realized I didn't. That's why I stopped it, because I didn't maximize. I didn't do the little trick at the beginning here. Let me stop sharing for a second. Then go back to share screen.
And maximize
Share
the sound.
sound and optimize video clip. And it's realized what I forgot to do that. Okay. Now let me put your thumbs up if you can hear it in a second here.
I'll try to
Yeah, we can hear it.
Okay, great.
work closely with you on this, but we really want to get this right. Obviously, on the right here is a seriously diseased artery. You're all probably saying, when that finally closes off, there's going to be a heart attack. Well, not so. Only about 10% of heart attacks come from something which is this ugly looking. On the other hand, I want you to look at the left, because even those of you in the back of the room will be able to see that which is the absolute guardian and life jacket of our blood vessels. All experts in this will agree to this. That single layer cell lining of our arteries, that magic carpet, has a name. It's the endothelium. The endothelium. E-N-D-O-T-H-E-L-I-U-M. The endothelium. Now, the endothelium has some very, very remarkable functions that we're going to talk about in a few moments. But first of all, what seems to go astray with the way we eat in this country is the following. Let's suppose, here we are on the left, you decide you're going to eat a milkshake, a cheeseburger, or some pizza. And what suddenly happens is our cellular elements in our bloodstream begin to get sticky. Sticky. Your blood is now no longer flowing like Teflon. It's more like Velcro. Your endothelial cells get sticky. Your platelets, your clotting factor, get sticky. Your white cells get sticky. And your bad LDL cholesterol gets sticky. I know you've all been waiting for this. But let's do it together. Up here, this is the work of Peter Libby from Harvard. And up here, the blood is flowing in this blue. You can see these individual endothelial cells here. Well, we're all going to work together and start here on the left and look up here in the bloodstream. Orange, your LDL cholesterol, which now is sticky, and it crosses through the sticky endothelium. So now in the subendothelial compartment, we have LDL cholesterol, which, as the artist has depicted by making it yellow now, suddenly gets oxidized. Oxidized by these nasty free radicals that we have in our diet. And the subendothelial compartment cannot abide those nasty oxidized LDL particles, so it calls upon our SWAT team, the white cells, which Peter Libby here has painted blue in honor of Yale. Nice. Okay. So, the white cells, or the macrophage, begins gobbling up like Pac-Man all these nasty LDL particles, and it gets over here, and suddenly it is now so chock full of these LDL particles that we in medicine do what we do so often to confuse you. We change the name. It's no longer a macrophage. It's now, well, I call it Darth Vader, but it truly is called the foam cell. Now, what is so nasty about the foam cell? The foam cell now is an absolute cauldron. It's a cauldron of oxidative inflammation, hydroxy radicals, hydrogen peroxide. And what happens is the foam cell manufactures these nasty, nasty chemical substances we call metalloproteinases. It's not on the test. Elastase, collagenase, metalloproteinases. What do that's so bad? They thin out this cap over the plaque. It gets thinner and thinner and thinner until here it's so thin that the sheer force of blood racing over that tears it. And now that seminal event has occurred. You now have ruptured your plaque. And here you are with a 30% plaque, which probably many, many, many of you in the audience have today. Completely innocuous, not a problem. Because 30% blockage is not going to give you any symptoms. You have to be over 75% blocked before you get symptoms. But this now, with the rupture, there's extravasation or the spillage out of plaque content into the flowing blood, which activates our clotting factors, platelets. Suddenly we now start forming this clot over this rupture, and the clot is in and of itself self-propagating, so suddenly, bingo, here we are. Now, that artery, in a matter of minutes, is totally blocked. And all that downstream heart muscle is been deprived of oxygen and nutrients. It starts to die. That's the heart attack. The classic that you all are familiar with, perhaps, that beloved TV commentator on Sunday morning, Meet the Press, Tim Russert. working a Saturday afternoon in his office for his Sunday program, ruptured his plaque, and sadly had a fatal cardiac arrhythmia from which the EMTs could not resuscitate him. So, but do you know the exciting thing about this nasty cascade that you see here? There is good news, and that is all I have to do is to convince you that if you simply change your internal biochemistry, doesn't take a great deal, but it's enough. When you stop injuring that inner layer, that guardian, that life jacket of your blood vessels, you stop injuring the endothelium, you raise that magic molecule that it manufactures, and what happens is you can never rupture your plaque. I'm going to show you today how you strengthen the cap over the plaque. That's how you make yourself heart attack proof. And guess what? There's no shot, there's no pill, there's no procedure, there's no operation. We're going to talk about 4 defense mechanisms that all of you have. 4 natural defense mechanisms today that are not being treated with standard cardiovascular medicine. And let me just say at the outset here, I have nothing but the greatest admiration and respect and reverence for the fund of knowledge of my cardiovascular colleagues. But we've been at this same deal, treating heart disease now for 60 years. And it's getting a little bit old because it doesn't seem to work. None of it is treating the cause. None of the drugs, none of the imaging, none of the procedures, and none of the operations are treating the causation of the disease. And Thomas Edison said that dissent is essential for progress. So let's have a little constructive dissent. All right. Now, this for years was a cartoon I had in my presentation. Halfway through his hearty man breakfast, Dwayne felt he felt several of his small arteries slamming shut. No longer a cartoon. Here, forget the x-ray. Just focus on this artery that's just half filled with a plaque, half still open. We used to think of these wonderful endothelial cells up until 1980 as cute little bricks that were lining these wonderful pipes. And then what happened was Dr. Furchtgott in Brooklyn, doing experiments with the rat aorta, the largest aorta in the rat, found that when he didn't injure the endothelial cells with a spiral cut and immersed it in saline, the artery dilated. So now the race was on globally. What was this factor that Furchtgott had discovered? And he labeled it the EDRF, the endothelial-derived relaxation factor. Thank heavens, that term was only around for 8 years. Because at the end of 8 years, Dr. Furchtgott, Dr. Murad, Dr. Luignaro, 1988, discovered it was a gas, nitric oxide, which we all make. And it has absolutely some wonderful properties. One, a wonderful level of nitric oxide keeps your blood flowing smoothly like Teflon rather than Velcro. Number 2, nitric oxide is the strongest dilator of blood vessels in the body. You climb stairs, the arteries to your heart dilate. The arteries to your legs dilate. Nitric oxide. Nitric oxide will also prevent inflammation from forming in the wall of your artery, keep you from getting arteries that are stiff, keep you from getting high blood pressure, hypertension. Number 4, pretty important, nitric oxide in plentiful amounts protects you from ever developing blockages or plaque. Number 5, nitric oxide will prevent migration of smooth muscle from the wall of the artery from growing into the plaque. Number 6, nitric oxide may destroy Darth Vader, the foam cell. So there is so much power in that. So I want to show you how to maximize the amount of nitric oxide that is produced. Now, you're probably sitting there saying, gosh, I really wonder what my level of nitric oxide is. Well, it's still a little bit of a research tool, but here's how they do it. First, you take an ultrasound probe place it over your brachial artery, all right? And there on the screen, there's the diameter of your brachial artery. For 5 minutes, then you'll have a blood pressure cuff encircle your upper arm, inflated above systolic blood pressure for 5 minutes. Now, I've had that done. It's not exactly habit forming, but then you release the cuff and immediately take their ultrasound probe, measure the new diameter of the brachial artery, and in the normal individual, it'll be 30% greater because of that time that the cuff was elevated. The next thing that happened that was wonderful was Dr. Robert Vogel, who was chairman of cardiology at University of Maryland, took a group of healthy young subjects to a certain restaurant which is characterized by arches which are golden. The half that had the cornflakes, brachial artery tourniquet test, boop, normal. That half that had the hash browns and sausages, within 120 minutes. Those healthy young subjects, after that meal, could not dilate the artery 120 minutes. That single meal had so savaged, had so imperiled, had so injured the capacity of the endothelial cell to make nitric oxide. They couldn't dilate. But as they followed them a number of hours later on into the early evening, they began to recover. But you and I know, the next morning for breakfast, oh, scrambled eggs and bacon. Lunch, how about some white bread with cold cuts and mayonnaise? Supper time, baked potato with sour cream. Lamb chops, vegetables soaked in butter, ranch dressing on a salad, and ice cream for dessert. Here in America, we just take those lovely little old endothelial cells, morning, noon, and night. We just pound them and we injure them, and then we graduate from high school with coronary disease. Okay, isn't it nice to get it all straight? All right, looking at some different diets. Here's flow-mediated dilatation, same thing as the brachial artery tourniquet test in a sense. The worst diet for that, Atkins. Next worst, South Beach. There's the champ, plant-based. All right, let's look at something else. Here's the new.
All right. Hopefully that was helpful. Hopefully you noticed that low carb diet was the worst for flow-mediated dilation. So even if you might drop, another example of cholesterol numbers, you might lose some weight and your cholesterol might go down eating that way initially, but then it's injuring your endothelial cells and increasing your risk for heart attack and stroke. And we have longer term studies that show just that. So any questions about that video? You can watch the whole thing. It's really interesting. He goes a lot more in depth on how to maximize your nitric oxide, and we can talk a little bit about it here too. Dark leafy greens is your champions for increasing your nitric oxide pool. I'm sure Charlie has some more videos on that too.
You bet. So don't be shy. If anybody has a question, feel free to ask it now. And if not, we're going to move on to what does plaque actually look like in an artery? Some of you may be curious. Okay, I don't see any questions here. So let me share my screen again with you. And we're going to go to #1 American killer, heart disease.
Representation of what happens when you eat high-fat meals. Watch this. This is a dramatic representation of what happens when you eat a high-fat meal, whether it's vegetable fat or animal fat. Initially, the blood cells, they flow by each other very smoothly. They actually repel each other, the cell membranes do, and you have this rapid, effective blood flow throughout the body. Then you eat the fat, vegetable or animal fat, goes through the gut into the bloodstream, coats the blood cells, and now they hit, stick, clumps, sludge, and now you have ineffective circulation. This affects the whole body. You feel sleepy and sluggish. People who have narrowed heart arteries, they get chest pain. This clumping and sludging causes the blood pressure to go up, and it continues, this sludging, for about 10 to 12 hours after you eat. And finally, after about 10 to 12 hours, the blood starts to break up, and we then have normal, effective circulation.
Boy, that was shocking. I'll bet my...
The fatty material called atherosclerosis.
This is a beautiful example of what atherosclerosis looks like. There it is.
So this is
And I'm
during
going to
heart
just gently
surgery,
tug on this now.
coronary artery.
I love it.
It's a little hard to pull. Dr. Coupad, if you could give a little pull too. We'll see if we can get this thing out.
We are just holding our breath so that you will finish the case.
There it is. America's #1 killer right there before your eyes.
It's important to understand that the heart itself usually remains.
Okay, we're going to stop there for a moment. Many people kind of get a little grossed out by that. That was the heart and an artery over the surface of the heart. And it was clogged up, removing the plaque, which has cholesterol and some calcium and whatever else is in there, fibrin and other products that form that plaque. Now,
One thing I always like to add, when they showed the sticky cells, flowing through really sludgy like that, I think it's really important to realize that, when we check people's cholesterol and things, it's always fasting. And so we know that heart attacks and strokes, they're not usually fasting events. They're usually what we call postprandial events, which means after eating a meal. And so some of you know my background. I was a paramedic for 10 years before I went to PA school. So I went on dozens and dozens of cardiac arrests, and almost every time it was usually after a meal, like a Thanksgiving meal, a Christmas meal. I've worked cardiac arrests in front of a Christmas tree on Christmas Day right there, and it's always right after a big meal. It makes sense because you see how slow and sludgy the blood was moving there. So if you have a ruptured plaque, then it's going to even be even more chance of having it blood flow stopped, because everything's already really sticky and everything, like Dr. Esselstyn showed earlier. So heart attacks and strokes usually occur after eating food.
Joan.
So you were saying that 10-year-olds already have plaques. So what he was pulling out there, 10-year-olds already have that building up?
They have streaks of early atherosclerotic change, maybe early. I'm not sure they don't have that thick clot like that at that age.
But that's what it will get to.
Correct.
Yeah, and Jerry even made the point in the chat about, because when we had Eric Colgrove speaking about the plant-based diets for pediatrics and families, he mentioned that even in the heart aortas of fetuses, so even before babies are born, there's already fatty streaks, evidence of fatty streaks in the biggest artery in the body, the aorta, already there in utero. So based on what the mom is eating, so it starts even before birth.
Okay, let's see if anybody else has any questions. We're looking around the gallery. You can raise your hand, or you can unmute, say hello, if you choose.
I have a question.
Yolanda, Okay.
Hi,
First.
thank you. So I think I heard him say that whether it was animal fat or plant fat, the effect is the same. That's
As
kind
far
of
as
like,
this,
huh?
yes, yeah, as far as the stickiness and the sludging, it doesn't
Yes,
matter, but it matters as far as developing plaque. That makes a difference. So it's, you know, it's the mostly like saturated fat and cholesterol in the diet that gives the building blocks for the plaque. But and then we think there's a contribution from animal protein itself causing more inflammation, and so there's a lot of, like I was mentioning earlier, a lot of aspects to it. So the heme iron plays a role. Things like TMAO plays a role, which drives the plaque into the artery walls, and you know, in the saturated fat and the cholesterol and the oxidation and the inflammation, chronic inflammation, all that free radicals, all that stuff plays a role in the whole process. But yeah, you're astute to pick up that the sludging can be from plant fats too. So if you're eating a lot of processed vegan foods and lots of oils and things like that to your diet, it can actually contribute to the stickiness and sludging too.
what about nuts? As I sit here eating some walnuts, I went,
Yeah.
oh,
Yeah, so that's why in Esselstyn's book and in his study, he said no nuts, no avocados, no olives for reversing his patients' heart disease very successfully. So
right,
you know, so but then Greger says it seems like people are eating some nuts are healthier in the long run.
right,
So if you have chest pain and you're ready to get an angiogram because they want to do a bypass or a stent, you have
right.
essentially 1 foot in the grave and 1 foot on a banana peel outside, probably following Esselstyn's choice of eliminating even plant fats to a great degree. That's what my wife and I did for a couple years. We had to really clean our arteries out, and then we resorted to going back to Greger and
Did
adding
you,
a 1/4 cup of nuts.
right, did you notice a difference in your health when you went back to eating some nuts?
No, other than I like the fact that I could eat some nuts again.
I know they're so good.
So if you're not having the end stage heart problem, or just recently had a stroke, then eating some nuts is probably a healthy choice, is my thought. I don't know. Scott, what's your take?
Yeah, same. If you're, because there's lots of studies that show nuts actually improve health outcomes. It's always like association, so we don't necessarily know cause and effect. And so like what Dr. Esselstyn made his food recommendations based on is that brachial artery tourniquet test. So he wants people to eat foods that do not injure the endothelium and maximize the nitric oxide production, and even things that are with oils and anything processed, even if it's plant-based. Even things like nuts and sometimes nuts and seeds would show some worsening of the brachial artery tourniquet test. So he kind of based it on Robert Vogel's work with all the different things that showed it would decrease nitric oxide production. But I think it'd be, I'd say for most people, if they're just trying to prevent heart disease, or they haven't had a heart attack or a stroke, or they're not super high risk, then some nuts and seeds is actually good. So
Okay, all right, thank you.
You're welcome. Now, there are a couple issues in the chat room. One says that her daughter was nauseated from pregnancy. Do you have suggestions? Gregor has a good video, I believe, on ginger added to the diet. I can't remember if peppermint does anything. I think it's ginger. So go to his site and do a search for pregnancy and nausea or ginger and see what it has to say. And then another off topic was the burn the pot of beans with a big smoke incident. Does anyone think renting an ozone machine works? I don't know what an ozone machine is. The house smells terrible. Sorry about that. You know, I guess this is one of the side effects of trying to do a whole food plant-based diet. Um, haven't heard that before. Anybody have any thoughts on that? Go ahead, Doug.
I'm a retired health inspector. And for 2.5 years, I inspected restaurants, and they used to put ozone generators in those, especially ones that weren't taken care of as well as I'd liked. But we eventually had them taken out because the ozone was a health risk.
There's your answer, Alice. No ozone. And I guess you open the doors and let the clean Idaho air take over someday.
So you're not supposed to be in the house when you run the ozone thing for it's like a 12-hour thing, and you get out of your house while you're doing it. Does it work? I see mixed things on the internet.
Doug? Unmute.
I'm a little slow. Yeah, well, apparently, you know, they were selling, I don't know, maybe the salesmen were just good, but people were paying for those things.
Well, Alice, if
you haven't read any papers on it.
Alice, if you do it, let us know. We're curious. All right, we're going to carry on.
Yeah, one other person had a question for me in there, and they want to know what, you know, is there a way to determine what your heart arteries look like? Well, there are, you know, you can do coronary artery calcium scoring as a newer thing, and based on your plaque burden, your score, that will give you an idea of what they look like. But you know, it's you know, whatever your cholesterol numbers are, that gives you a little bit of a hint. But yeah, other than that, it's all about assessing risk and kind of look at what your overall diet is like and your lifestyle, and that helps you determine what your risk is. But yeah, there's a lot of you go and seeing your provider, and there's a lot of risk stratification tools that are at our disposal, but they're all basically designed to help motivate you, hopefully, to make healthier choices instead of, you know, because if it's what you do with the information that's most important. So if you say, oh, my coronary artery calcium score is pretty low, I'm just going to keep eating bacon and eggs and keep smoking, then that's not a good idea. But if it's like, oh yeah, it's going to motivate you to change your lifestyle, or in a standard American doctor's mind, it would be to get you to take a statin, for example, but to reduce your risk a little bit. But that's, you know, not going to reduce your risk nearly as much as changing your diet and lifestyle.
Okay, I've got another video for you, and then we're going to incorporate it in that video is what it's like to have a heart attack and potentially a stroke, and then what you might choose to do about it before that event occurs or even after. So let's go to heart attack survivor thrives on a plant-based diet. I wonder why we would be using those words.
It was just a typical Friday afternoon. I was at work. I work at a manufacturing plant, and I'm walking down the aisle, and all of a sudden I just felt a tingly feeling throughout my body, and it like made me stop, and I just kind of like looked down at my body, and it's like, never felt that before, you know. But then I continued to walk, and still felt just a little bit funny. So I get back to my office, and I sit down in my chair, and, you know, I kind of kick back and try to assess what was going on. And that made me a little bit lightheaded, you know, but then I started to sweat a little bit. And that's just, it's not really like me. I don't sweat a whole lot unless I'm working out or something of that nature. So I picked up the phone and called our HR director, and I said, I'm not feeling too good. She says, well, do you want me to like call somebody or drive you somewhere? And I said, yeah, why don't you call 911? They got there within 5 minutes, and paramedics come in. They hooked up a 12 lead to me, and the paramedic looks at me, he says, it appears that you're having a heart attack. Prior to my heart attack, I always felt that I was a pretty healthy guy. I was 175 pounds at the time and had just lost 40 pounds and had maintained that and was working out 3 or 4 days a week and eating much better. So when I had my heart attack, it just kind of like totally threw me for a loop because I didn't understand it at all. I'm in the recovery room and my son was there. And I looked at him and I said, "Hey, what's up?" He says, "You need 3 stents." I'm like, "Oh, cool. When am I going to get those?" He said, "They already put them in you." He said, "You flatlined 3 times. They had to shock you 11 times. They didn't think that you were going to make it."
It was me and my brother. We went to the hospital. I remember my brother was freaking out. My brother was like crying and like, "How are you guys so calm?" And like, the doctor had heard us talking about Willits, and he turned around really fast. He was like, "Willits?" Like, "Oh, he's in the cath lab." He just, we almost lost him. And so we walked to where he was at, the room he was at. He kind of realized how real it was.
That's when it just all started to kind of like click on what I had just experienced. I still hadn't put it all together, but I realized that what I felt was death. I felt what it was like to die. I felt the last, what was almost the last breath of my life, and an experience like that is everlasting. There's not a day that goes by that I don't think about it, but it's also a wake-up call, and it was an opportunity for me, unlike many others that didn't get that opportunity to make a change, to want to not have to go through that experience again. Cleared out all the junk in my refrigerator, just threw it away, went across the street to the grocery store, picked up every leafy green that they sell. Of course, it's all labeled when it's on the counter and you pick it up, but when I got home, I had no idea what to do with it. I mean, I didn't even, there was no label. I didn't even know what it was anymore, so I couldn't even like Google it to see what I was supposed to do with it. But from that day on, it's been over 4.5 years now, I have not touched any animal or dairy product whatsoever, and I really don't intend to. A lot of people think that I'm extreme with what I do, and I get it. Maybe I am, but with what I experienced, I mean, that was an extreme thing to me, and so it was worth taking a chance. It's been 4.5 years now. I've never felt better. Feeling what it's like to die just gives you a total different perspective, and knowing that you've made some adjustments to hopefully prevent that from happening again is a peace that I wish everybody could experience.
Okay, so we're gonna stop there for a moment. Doug, you still have your hand up. Is that a new hand or is it an old hand? An old hand, okay. Anyone else? I'm gonna look around the gallery, see if you have any comments, suggestions, thoughts about this. Joan.
Can you explain triglyceride numbers?
Sure. And so they're kind of the neutral fats that float around in the bloodstream, and normal is under 150. And so interestingly, it's kind of doesn't have it's not necessarily an independent risk factor for heart disease. We know that it kind of, if they're above 150, then it seems to have plays a role in the process of heart disease, but we don't really know exactly what it is, because drugs that we would use to lower triglycerides, like fenofibrate, gemfibrozil, studies have been done on those, and they have not shown to reduce the risk of heart attack or stroke. So they kind of fell apart when you use them in that way. But the only time we do use them is usually if somebody's like over 300, 400. So when someone has triglycerides that are over 300 or 400, then there's risk of getting something called pancreatitis. So the pancreas gets sick and it's really bad. So someone now the latest recommendation is if it's over like 300 to 400, get them on the fibrates to lower the triglycerides so you don't have pancreatitis. But as far as using them as a primary prevention tool to prevent heart attack and stroke, that's not recommended anymore. So it's kind of one of these kind of like, it seems to play a role. So it's not good to have high triglycerides. So things that raise your triglycerides are like alcohol, white sugar, white flour, any kind of simple sugars basically, and flour products. So like if you eat like bread and bagels and things like that, and then sugar and alcohol and fruit juice and soda pop and things like that, those all raise your triglycerides pretty significantly. And then there's a genetic factor too. Some people are prone to developing high triglycerides, even if their regular cholesterol numbers are pretty good, their triglycerides can sometimes still be high. So yeah.
So if you've spiked your numbers pretty high with diet, can you bring the numbers back down with diet?
Yes, you can. Yeah. I mean, some people that are genetically high can only bring it down so far. And so I've had patients that were over 1,000 on their triglycerides. And so they're on the fibrate drugs to try to get it down at least below 300 or 400 to reduce the risk of the pancreatitis. But yeah, the typical person, most people that are kind of have what we call metabolic syndrome, which is kind of like, it's low HDL when you want to be higher. It's high triglycerides, anything over 150. They have elevated fasting blood sugar. So they kind of have the setup for prediabetes and diabetes. They tend to have the triglycerides that are over 150, so between 150 and 300 and stuff. And so when you have them cut out the alcohol, the white flour, the white sugar, all the processed foods and stuff, and a lot of the fats too, because that can raise it too. Just eating bacon and sausage raises it too. So if you get them off that, you can get those numbers down to usually the ideal range, into the 50 to 70 to 80, kind of around in there, if they change their diet.
Thanks.
Leslie.
Yeah, Scott, you touched on alcohol when you were answering that question. I'm wondering if you can expand on the alcohol related to heart disease. I know it's a risk for cancer, but if you could talk a little bit more about that in relation to heart disease.
Like, I mean, as far as it raises the triglycerides, so it causes liver fat and insulin resistance. So it's it has, because alcohol is a type of sugar. So if you think about it that way, it's a sugar. And so then it's going to cause liver inflammation, liver fat. It's a lot of calories. Empty calories is another, because alcohol is 7 calories per gram. So fat is 9 calories per gram. Alcohol is 7 calories per gram. And then protein and carbohydrates are 4 calories per gram. So it just has a lot of calories with it. So and then likely it can bring on inflammation, things like that. So and so it's the alcohol, but I think it's also kind of like with beer, for example, it has a lot of the carbohydrates with it too. So that adds to the calories as well. But beyond that, I'm not sure what other role it might have in heart disease, other than just increasing the fats and inflammation and things like that.
And remember, the deficiency in the American diet is fiber. There's 0 fiber in alcohol. And when you're eating calories, you want to try to maximize the amount of fiber that you're getting in your diet. Anybody else have any thoughts, suggestions? I'm going to go back and look at the gallery here again and see if there is anybody.
Question about statin.
Pam?
I have a
Go ahead.
question about statin. Dr. Greger says that if you've had a stroke, which I have had, that you need to be on a statin, period. And I wondered if that was the current ideas or if those ideas are his from some time ago. But if you look up his videos on statins, he'll tell you that if you've had a stroke, you need to be on statin, period.
Yeah, it's still that way. It's that way for stroke and for heart attack. So if you've had, so that's called secondary prevention. So when you've already had, since you already had the disease, you have the disease and you're already symptomatic, then it's a good idea to be on a statin because it adds a little bit of protection. So it can not only lower the cholesterol, which is the building blocks, but it also has been shown to help stabilize the plaques a little bit. So it has some other effects. So, definitely if somebody has already had a heart attack or a stroke, then it is recommended to be on a statin for those reasons.
But that doesn't mean that you should stay on the standard American diet because you're taking the statin. That means that you should be on a whole food plant-based diet and take the statin if you've already had a stroke or heart attack.
I've been whole plant-based for 8 months now, so I'm doing the diet and lifestyle as well as the steps.
Very good. Very good. Now, I have a quiz of the night for you. And the quiz question for the night is, in his book, Prevent and Reverse Heart Disease, I don't recall exactly whether he makes the recommendation of eating dark green leafies 6 times a day, but I do know in other talks he does. I suspect in this book he does. Why would you choose to eat dark green leafies 6 times a day if you want to prevent or reverse heart disease? Anybody have the answer to this question? And it has to do with a gas. Jamie, anyone? Jennifer.
I'm guessing it increases your nitric oxide.
Excellent.
Keep doing that 6 times a day. Yeah.
All right. So you remember him mentioning nitric oxide, how it keeps the inside of your vessels like Teflon, smooth, as opposed to like Velcro. And so you really want to increase the nitric oxide. And does anyone know how the nitric oxide is produced when you're eating the dark green leafies? How that happens? Yolanda?
I don't know.
Okay. Alice?
I'll wait for some, well, I think it has to do with gut flora.
Well, that's a good guess. It actually has to do with the GI system and a run.
Oh, yes, Charlie. Let's see. It's the, when you chew things like spinach, for example, the saliva is helping produce that, yeah?
It has bacteria in your mouth, which combine with the dark green leafies, these bacteria then get into your stomach, and somewhere between the mouth and your stomach or both, they produce this nitric oxide from digesting the dark green leafies. So good for you all for participating in that. That was kind of fun for me to share that rather than just coming out and telling you about it.
Sure.
All right. Anybody else have anything that they care to share? Does anybody need help transitioning their diet? Like you're stuck, or you know someone who's stuck and you need a little counseling. That doesn't cost anything. Is anybody in that position in this room, or does everybody, I get it. I don't need any help. Everything is wonderful. Just kind of curious. I'm doing a quiz. Yes, Alice.
Well, no, I'm sometimes stuck even though I kind of know. But most recently, I went on a trip, a vacation, and I went to South Dakota. And it is the land of Fritos, Doritos, and Cheetos.
Yeah.
And maybe there's a rare leaf of iceberg lettuce, and there's hamburgers and hot dogs. And I mean, talk about like, there really wasn't access to great food. And I was really stuck. And I didn't even ask for a veggie burger because I didn't want to, be shot or anything. So,
Yeah,
yeah. So
we get that.
it was a bicycle ride, a week-long bicycle ride. So they feed you, but that was the choices.
Yeah, that's pretty tough for sure. We found that when we went on our Alaska vacation a year ago. We could hardly find a place that had food that we could eat. It was Fortunately, we were only there for 5 days because we got COVID. But by the fifth, we were living on our body fat for a few days in Alaska.
I have a suggestion.
Go ahead, Yolanda.
So, Dr. Greger endorses leaf-side packaged foods. I'm a backpacker, so we have some in our freezer to use for that purpose. You just add hot water and wait. And we tasted one. We haven't gone on a backpacking trip, but it's bring your own food. If I go to a friend's house, I pretty much bring my own. I'll bring my lunch because people are uncomfortable with it. So I just provide my own. But anyway, leaf side tastes pretty good.
So the brand is Leaf
Side, LEAFSIDE.
And do you order it online?
Yeah,
or?
Yeah,
Okay.
we ordered. They have a subscription. Well, when we bought it, we thought we could just order X amount. There was a minimum, and we ordered the minimum, and then we got notice that our next order was being sent automatically, and we're like, wait a minute. Well, we don't intend to do that. But my husband spoke with them, and they cleared that up. And I think they're thinking about just allowing one-time orders. But the one meal that we have tasted it was very good. It's kind of, you've backpacked or the mountainside and those different things, only it's all whole food, plant-based.
Does
There's
everybody
a
understand that stroke and heart attack, if you don't want either one of them, that you're essentially going to live your life the same way? You're going to eat the same foods. You're going to move throughout the day as much as you're able to. You're going to avoid chemicals like smoking and drinking. You're going to deal with stress with motivation, yoga, prayer, whatever works for you to deal with stress. You're going to maximize your sleep. If you have sleep apnea, you're going to use your machine and social connections. You're going to find meaning in your life and fun activities to do, and those sorts of things. If that's what you want to do, is prevent either stroke or heart attack. Any questions about that? Yes, Doug. Go ahead and unmute yourself.
Yeah, I was going to ask a different question. Non-alcoholic fatty liver.
Yeah.
And that was diagnosed maybe 5 years ago before I started doing it. Will this diet reduce that any?
It may, I think, is the bottom line.
They did another test and it hadn't advanced to the intermediate level, I guess it is. So.
Yeah, it definitely does. And there was a study through the Physicians Committee for Responsible Medicine, Hanna Kaliova, who is the head of research at the Physicians Committee for Responsible Medicine. And I actually saw that I was at the conference in DC when she presented it, and actually did show reduce a whole food plant-based diet reduced liver fat over a period of time. And then also you can add a teaspoon of the spice ginger every day too. That has been also been shown to independently reduce liver fat. So a teaspoon a day of ginger on
Dried
a whole
ginger,
food plant-based diet.
dried ginger.
Yeah, just whatever. I think in the test in the study, it was just powdered ginger from the spice rack and put into a capsule, because that's how they do it to randomize it, and blind it and randomize it. So, but just, yeah, I do your, whether it's fresh ginger or dried ginger, whatever you want to use on your dish, just do that, a teaspoon a day.
Thank you.
And I wanted to address, there was a question in the chat about oil, because we heard about with Dr. Esselstyn, no oil and all that. So the question is, doesn't our brain need oil and for energy? And it's like, it's true, we need fat for our body. Our bodies do need fat and our brains need fat, but the healthiest way to get your fat is just from the food. So things like even nuts and seeds, avocados. I mean, even broccoli is like 8% fat. So there's fat in all food, and so there's no such thing as a no fat diet. So even 100% whole food plant-based diet without any oil is still about 10 to 15% of the calories are still coming from fat. So so if you don't need to eat fish and all those other fatty animal foods to get the fat you need, you just need to eat to get enough fat from the whole plant foods. And you can do, and then there are, you can eat the nuts and the seeds and things like that, and sea algae and things like that to get your omega-3s. And so you'll get all the fat you need from a whole food plant-based diet. Oil is just a processed food. And it's not a healthy food, it's just processed. But with that being said, some people will still go, well, I'm gonna not give up oil 100%, so which oil should I use? And so then I always, people that are not willing to give up oil 100%, I just say, well, olive oil is the best of the oils. And so if you're saying is olive oil healthy? Well, no, it's not healthy compared to whole plant foods, but but olive oil would be healthy compared to coconut oil and palm kernel oil and all the other processed oils. And so if you're going to use any oil, it would be the olive oil. But again, you don't need the olive oil. Just eat the olive, because that's where the fat came from. So just eat the food and get your fat, just like getting your protein, your carbohydrates, your vitamins, minerals, fiber, all your nutrients. You can get it from the whole plant food.
Run and then Joan.
A small question. Suppose we use 1 spoon, like a 1 tablespoon of oil in a whole meal. Is that too much? I mean, I understand that having avocados or nuts is better, but sometimes in Indian cooking, we use a touch of oil to, saute onions and such. And I know that one time Eric's wife had shown us how you can spray water to saute the onions. But, it's not the same as using oil. So my question is 1 teaspoon of oil in a whole meal for 2 or 3 people, is that too much?
Just going to depend on what your health issues are. If you're not overweight, you don't have high blood pressure or heart disease, you're not on any medications, you're active, and you're pretty, you're pretty healthy. Otherwise, a little bit of oil is not going to be harmful. It's going to be probably going to be fine. But if you have some of those problems, you have diabetes, you have heart disease, you're on medications, you're overweight, then it's just empty calories that are not necessary. And the oil can actually injure the endothelial cells, like Dr. Esselstyn was showing there and talking about. So you just have to make that decision based on your own individual goals and your health issues.
Thank you.
If you ask that question to Dr. Esselstyn, he'd say, no oil. I have heard him before, but Scott's answer is definitely correct. You get to choose whatever you want to eat. And it's providing a bit more inflammation and sludging of the blood potentially, but maybe in small quantities, it's not such a big deal. So
yeah, well, I have kind of pretty much allowed myself not to eat cheese and butter and, milk and yogurt and all that. But yeah,
You've
I'm
come a
not,
long way, so
no,
congratulations to you.
thank you.
Celebrate the successes you've made, and if you're otherwise healthy, um, uh, do what you find and keep listening to the science.
Yeah, yeah. Well, I want to add something. Last month, I had gone for a 5-day rafting trip on the Owyhee River,
Yep.
and it was with a group, and they provided meals, and every meal they had salads, organic salads too. And for vegetarians, they had choice, like plant-based, but sometimes plant-based meats too. So it was processed. But anyways, slightly better than standard American diet or going to South Dakota. It wasn't as bad as going to South Dakota.
That's great.
Thank you.
Okay, thank you. Joan.
Okay, this goes back to the dark leafies and 6 times a day. And if you're processing it with your saliva, where do smoothies fit in?
Yeah, probably decrease the amount that you produce just because you're not chewing it, because it's the bacteria in the crypts of your tongue that convert it. So you're not having that chewing motion. It's probably going to decrease. And I know Dr. Esselstyn does have a problem with smoothies, but because it's been churned up and processed, so then it can potentially cause a little bit more inflammation because your this blood sugar and insulin levels would go up a little bit faster and whatnot. So, but again, if you're not trying to reverse heart, you're not, trying to reverse heart disease, you're not trying to avoid a stent or a bypass because it's pending, the smoothie would be fine. Smoothies are very healthy if you sip them slowly, but I'm just kind of parroting what Dr. Esselstyn would say in that situation.
Okay, thanks.
Good thoughts. Anyone else have any comments, suggestions, thoughts? Let me go back to the gallery here and see if there are any hands or anybody who's kind of excited for a question.
I just want to make a comment that at the beginning, when you showed the video of Dr. Greger and his analogy with whacking your shin, I think that is like the best analogy to demonstrate like what you're doing to your body every time you eat something. I just love that analogy. I've heard it probably a dozen times now, but every time I hear it, I'm like, that's right. That's the best way to describe it. And I think people who maybe don't quite understand it, I think that would really hit home for most people that maybe don't understand, the whole food plant-based, which I do run into occasionally with folks. But I think that's one of the best analogies with our diet and the standard American diet. So
I agree with you on that, and I really like that video and how he says it. And, thank you for sharing that. Anyone else? Alice, go ahead.
Well, so I'm not all plant-based and, all the way there, but I was in rural South Dakota. And so not only was the food really awful, but I passed a lot of farms and dairies, and like these big dairies, the cows never leave the barn. The hay comes to them. They just stand there. They have this life in the barn. And then there were these other completely closed barns that you could smell from good half a mile away. And I was told these are pig farms, and the pigs never ever, the smell was so bad. It's all sealed up. They have giant fans pushing air into the building. It's like, oh my gosh, this is cruel. And it smelled so horrible. I'm like, oh my gosh, they have to be standing ankle deep in their poo. It was like, wow. Cause I'm, live in the city. I'm not on farms, but it was like, oh my gosh. And the cows, the dairy cows, they never get to leave these like you know, they have these metal things around, you could see them from the road, like metal things around their, like stalls where they put their heads through to eat the hay that's delivered to them. And then lots of like kind of pesticide barns, like big silos of pesticides. I'm like, man, that doesn't look too great either. It was kind of eye-opening.
It's sort of like living in concentration camp environment. And yeah, it's very, very sad. I agree with you completely. I must tell you, I had an experience learning about animals. You know, we tend to think, do animals, you know, think and feel and stuff. My wife and I were out walking in Roseburg, and she kind of made some comments to a cow. A cow came walking over to us one day, and kind of she pet the cow out in the field. And then, as it turns out, day by day, over the next several weeks, as we would walk, the cow might be way out, several hundred yards away. When we came around, that cow would actually come over to greet us every day, like it had befriended us. And when you have experiences like that, what you describe about how animals are treated makes one very averse to eating those creatures. We don't always talk about animal welfare. Yeah, go ahead.
I have a pet cow, so, and he very much gets excited when we go out there. So yeah,
it's pretty amazing.
He's like a big dog.
Well, on that note, we've made it an hour and a half. It's flown by. Scott, what's going to be on the agenda for next week?
Hypertension, high blood pressure next week. So kind of carrying with this cardiovascular theme. That's next week.
Well, thank you for all your input, and we appreciate all the questions from everybody and the answers. And God, it was fun tonight. And we look forward to being with you all again next week. Ron, one last question.
When is our some kind of picnic potluck?
Oh yeah.
Oh,
thanks for bringing that up. That's this coming Saturday at 6 p.m. at Island Park in Springfield. So the information is on the Eugene Plant-Based Provider website. So pull up here. Let me escape this. Get rid of this. Let's go here. So it's just let's go down to Eugene Plant-Based Providers. So eugeneplantbasedproviders.com, and then just go to upcoming events. And here it is, all the information. You can RSVP here still, and then all the information about where to go and what to bring and everything all here. So yeah, I hope to see you guys out there this coming Saturday, June 15th at 6 p.m. Day Island Park.
Thank you so much.
Yeah.
Very good. See you all there.
Thank you. Good night.
Good night. Thanks again, Scott.
Thank you.